Hello, I'm going to talk to you today about some ethics involved in dentistry. So first off, I want you to think about going to the dentist and what's going through your mind. Now I'm going to guess that you're probably not thinking about the ethics involved in running a dental practice, but for a dentist, they have to think about many things. Because being a dentist isn't just cleaning teeth or filling cavities, but also you have to run your own business. And so this speech is relevant to you because when picking your dentist in the future, not only do you have to decide who you want to be your dentist, but your dentist also has to accept you as a patient. And I've gone to the dentist my whole life, and I've been surrounded by dentists, with my uncle being a dentist, and many of my friends' parents are dentists and orthodontists, so I've been exposed to the field for a number of years. And I found that one ethical dilemma seems to stand out, and that's whether or not to accept new patients based on their income. And that's what I'll talk about in my first part of my speech, and then I'll move on to some advice on how to approach the situation. All right, people don't think of dentistry as a business, but it is. And as a business, you have to make money to keep going. So many people don't have dental insurance because it can be very expensive, and their jobs might not give them dental insurance like they do medical insurance. And they can pass up the need for people to go to get regular checkups, and without these regular checkups, you can get bigger problems arise, such as toothaches, which can be extremely painful. And that raises the question on whether or not, as a dentist, you should treat this person even if they can't afford to pay for your services. And while the humane answer appears an easy yes, you have to think about your business as well and how this will affect your business, because you'll probably actually lose money if you treat this patient because you have to spend time and materials on this. And so some questions to think about is that if you do end up treating this patient for free or reduced price, should you treat every patient who comes to you for free or reduced price? And if not, where do you draw the line on who you should treat for free and who you shouldn't? And is this really fair to others who have made an honest living and are able to afford and pay for dental insurance? Now, when I was thinking about what I would do in this situation, I kind of became torn between two sides because my humane side and my business side just pulled at me from both sides, so I was stuck in the middle. So I decided to ask two dentists what their opinions were. And the first one, Dr. Lang, who's been running his practice successfully for over 20 years now, and I've known him my whole life, has this opinion on the topic. I feel that as dentistry is a health service profession, everyone is entitled to receive treatment, but not every dentist has to give treatment to every patient. And what he means by this is that if you want to give treatment to a patient, then you could, but the government shouldn't force you like they do some medical doctors. And this also leads into what Dr. Uthoff has to say on the subject. He's my uncle, and I've known him my whole life, and he's been running a very successful practice for over 20 years. He had this opinion. I think that dentists who can afford to treat a patient for free or for a reduced price should do so. But if they cannot afford to treat people for the sake of their business and continued practice, then they should not be forced to do so. So I kind of started to wonder, is there a program like Medicaid that people can go on for dental insurance or dental care? And it turns out that the Center for Medicare and Medicaid Service website states that Medicaid actually includes a program for people under 21 to receive treatment, but only people with very low income, and you also have to meet many other eligibility requirements, can get on Medicaid. So it's sometimes very hard to do that. And so this dilemma seems to affect the people that are right above the Medicaid cutoff, but they don't have enough money to put towards dental insurance, so they have to put it towards their medical insurance first. And this leads to the bottom line of what you should do as a dentist. If you can afford to give people free, reduced, or a long-term payment plan, then you should do so, but if you can't, then that's okay. So today you've seen the difficulties in deciding whether or not to take new patients or to send them to a different office based on if they can afford it by their income. And deciding can be very difficult, especially when money is involved. And now that you know the thoughts that are going through a dentist's head and deciding whether to accept people or not, next time you go to the dentist, ask your dentist how he makes his decisions on who to accept as his new patients and what his deciding factors are. Thank you.